Okay, in this video I'm going to talk about the acute kidney injury in children. I'm going to start with the definitions of the acute kidney injury, and then I'm going to go over the classification of acute kidney injury according to the pediatrics Rifle criteria, then the pathophysiology and the categories of acute kidney injury so that you understand how does it happen. And after that I'm going to get into the approach of acute kidney injury: history, physical examination, investigations, proper investigations. I'm going to explain the management of acute kidney injury. So let's start without wasting time with the definition of acute kidney injury. Actually, from the name or from the title, it's an acute, sudden okay, inability of the kidney to maintain body chemistry and fluid balance. Okay, so two of the most important functions of the kidney is to maintain body chemistry and fluid balance. Okay, it maintains the sodium, the potassium, the calcium, the magnesium within normal ranges. Okay, and it maintains the blood, the fluid volume in normal ranges. Okay, so if we have an insult to the kidney due to any cause, I'm going to go to explain these causes. Okay, but if we have sudden inability of the kidney to maintain its normal functions, which are the maintenance of the body chemistry and the fluid balance, then we have an acute kidney injury. Okay, and that failure or inability of the kidney to maintain body chemistry and fluid balance should be sudden, okay, to call it the acute kidney injury. Okay, actually the acute kidney injury is potentially reversible, fortunately. Okay, a lot of cases of acute kidney injury may reverse to the normal status. Okay, so is inability of the kidney to maintain the function that the kidney are responsible for, which are the body chemistry and the fluid balance. Okay, actually this term used to be the acute renal failure. We used to call the acute kidney injury the acute renal failure, but now the acute kidney injury concept has replaced the acute renal failure, because the acute renal failure means the kidney have failed. Okay, the kidneys have failed, but in acute kidney injury is a term that have many things in it. Okay, one of them is the kidney failure. Okay, the acute renal failure, one of the things that the acute kidney injury has in its umbrella. Okay, so the acute kidney injury include number of conditions that affect the kidney function and structure. One of them is the acute renal failure, but not all of them. Okay, so acute renal failure concept is one of a lot of things that go under the umbrella of the acute kidney injury. So this is the general definition of the acute kidney injury. Now let's go to the definition of acute kidney injury in number. Okay, I told you that the kidney most important functions is to maintain the body chemistry, and you know that we use the creatinine as an indicator of the kidney function. Okay, so if we have a kidney injury, kidney insult, and the kidney is not able anymore to get rid of creatinine, okay, so we will have an increase in creatinine. So this is a very important indicator to define the acute kidney injury. Furthermore, if we have a decrease in urine volume, it is also an indicator of acute kidney injury, because the function of the kidney that we notice, okay, as a normal people, is to get rid of the fluids in the body. Okay, so to give us the urine. If we have a depletion in the urine volume, then it is an important indicator of acute kidney injury. Now let's talk specifically. If we have an increase in serum creatinine of more than 0.3 milligram per deciliter in 48 hours, okay, then we have an indicator of acute kidney injury. But actually the urine volume depletion is much more important than increase in serum creatinine, because serum creatinine is not that sensitive to acute kidney injury because it may requires about 50% change in glomerular filtration rate to start changing. The creatinine may not change until 50% change in glomerular filtration rate happens. Okay, so the most important, the most sudden, and the most acute thing to happen after an acute kidney injury is decrease in urine volume. How in numbers, okay, we have to have more than 0.5 milligram per kg per hour, okay, decrease in urine volume. Okay, or in other words, if you take the urine volume in 6 hours, okay, and it was less than 0.5 mil per kg per hour, okay, so you have an acute kidney injury. Less than 0.5 mil per kg per hour. Please remember this number, okay? 0.5 mil per kg per hour for about 6 hours. If you have 6 hours, each hour of them has less than 0.5 mil per kg per hour of urine, then this is an indicator of presence of acute kidney injury. And if you have an increase in creatinine more than 0.3 milligram in deciliter in 48 hours, then again this is an indicator of acute kidney injury, but it is not that sensitive. So the most important is the urine volume. Okay, or you can, in other words, say that you have more than 1.5 times of serum creatinine in 7 days is an indicator of acute kidney injury. So these are the minimal requirements of to call the condition acute kidney injury. Okay, we have to have these as minimal requirements, but the acute kidney injury more develop more, okay, and have much more severe decrease in urine volume or increase in serum creatinine. We have stages of kidney injury I'm going to talk about in a classification of acute kidney injury or in pediatrics rifle criteria. Okay, I'm going to delay that just for some time to understand the acute kidney injury. I will start with the causes that will lead to acute kidney injury, the categories of acute kidney injury. Actually, to understand this, we have to understand that the kidney function is to receive a blood from the renal arteries, okay, to have about the 20% of the total blood volume or the total cardiac output will go to the kidney. So it receives blood from the vessels, and then it processes that blood, absorbs some materials, okay, secrete some things in the tubules, and after that should get rid of that blood into the ureters, and after that bladder, the urethra. Okay, so if we have a problem in the blood receiving, okay, if we have decrease in blood that will go to the kidney, okay, then that may lead to acute kidney injury or acute renal failure, because there's something wrong with the function of the kidney, because it doesn't receive the appropriate blood from the body. Okay, so this is the first thing, the prerenal cause. Or if we have an insult to the kidney, insult to the tubules, for example, or insult to the glomerulus or to the vessels of the kidney, okay, that may lead to inability of the kidney to do its kidneys to do their function. Okay, then we have what we call renal causes of kidney injury or intrinsic causing. Or if the prerenal bloodstream is normal, okay, and the kidney functions are great, the tubules are very good, but after the blood or the urine passes the kidney to the ureters or to the bladder, we have for example an obstruction, a tumor, anything that prevent the urine to complete its way out to the toilet, then we have what we call the post-renal causes of acute kidney injury. So please keep in mind these 3 points. I'm going to start with the pre-renal causes of the acute kidney injury, and actually prerenal cause of acute kidney injury constitute the most important thing to cause acute kidney injury. Okay, in prerenal causes we have functional defect in the kidney. I told you a prerenal cause is all about the blood that reach the kidney. Okay, so it has nothing to do with the normal structure of the kidney. Normal structure is normal. Okay, the kidney structure is normal, but we have a functional defect. Remember that, because in renal causes the structure and the functional things are in damage. Okay, so we have in renal causes both structure and functional damage, but in prerenal cause the problem is just in the function of the kidney, not in the structure of the kidney. What really happens in most cases of prerenal kidney injury is we have a volume depletion due to any cause. For example, due to decreased cardiac output, the pump that pump the blood to the whole body has something wrong. For example, we have a congestive heart failure or pericarditis or cardiac tamponade that decrease the cardiac output, and the decrease in cardiac output will decrease the renal blood flow, and that will lead to prerenal acute kidney injury. Okay, maybe a systemic vasodilation. We have a normal cardiac output, we have normal blood in the vessels, but we have a vasodilation that will lead, or that led to a decrease in a blood volume that reach the kidneys. So the systemic vasodilation due to sepsis, for example, is a cause of acute kidney injury, the prerenal acute kidney injury. If we have volume depletion due to renal losses, GI losses, cutaneous losses for any cause, for example, burning. Okay, so any loss, we have a normal pumping function, we have no vasodilation, but the body is losing a lot of blood due to renal causes, due to GI losses, due to cutaneous losses, for example, in burning. Okay, then we will have also volume depletion and prerenal acute kidney injury. If we take a drug that decrease the blood volume, like diuretics, the ACE inhibitors, and non-steroidal anti-inflammatory drugs, very important to recall, the diuretics, ACE inhibitor, non-steroidal anti-inflammatory drugs, depletion in these drugs will lead to hypoperfusion. Okay, I'm sorry, will lead giving these drugs may lead to volume depletion and acute kidney injury. Also, we have what we call hepatorenal syndrome, not going to get into details of that. Okay, so we have volume depletion as a result of all these conditions. The volume depletion will lead to hypoperfusion to the kidney, hypoperfusion to the kidney. You know, we have the renal artery, that we have the afferent and the glomerulus, the efferent arteriole, and then we have the tubules, and so on. Okay, so you have decrease in the afferent blood flow. Okay, so you have a decrease in the glomerular filtration rate, but still you have normal tubular structure. So it is all about the function, not the structure. Okay, so decreasing the glomerular filtration rate will lead to kidney failure or kidney injury. Okay, so this is the most common cause of prerenal causes of acute kidney injury. But we have also we may have vasoconstriction due to any cause that will lead to decreased blood supply again to the kidney, lead to hypoperfusion, decreased glomerular filtration rate, and kidney failure that will lead to accumulation of creatinine, accumulation of a lot of things. Okay, or if we have an occlusion due to thrombus, due to embolus, due to anything, okay, again you may have a prerenal acute kidney injury. So this is the first big important category of acute kidney injury. The second category is about the renal causes. Okay, in renal causes we have some insult that led to renal structure and or the kidney function and structure damage. Okay, we have damage in the kidney tissue, and this is the hallmark of acute the structural changes or the structural damage in the kidney is the hallmark of the renal or intrinsic causes of acute kidney injury. And to summarize that, we have in the kidney we have the glomerulus, you know, the glomerulus I talked to you about. Okay, we have the tubular or the tubules that comes after the glomerulus. This is the glomerulus. Then we have the tubules where the absorption and secretion happens. happen. Okay, and we have the interstitial tissue of the kidney. So anything that may insult the glomerulus or the tubules or the interstitial tissue of the kidney may lead to renal acute kidney injury. For example, in glomerulus, what may happen? We may have a glomerulonephritis, inflammation of the glomerulus, and this may be due to the an infection. Okay, an infection like post streptococcus infection. The patient will come to you with a previous history of 2 weeks ago, for example, having streptococcus, upper respiratory tract infection, and so on. Okay, and that will lead to glomerulonephritis, that will lead to kidney injury. Okay, or the glomerulonephritis due to autoimmune disease. So this is about the glomerulus. What about the tubules? Okay, we may have a condition of what we call the acute tubular necrosis. Acute tubular necrosis of epithelium cells of the tubules. We have a damage to tubules, and this is made due to hypoperfusion. Oh, what is hypoperfusion? The prerenal causes. So we get back to prerenal causes. If we have a volume depletion due to any cause, and then we have a hypoperfusion to the kidney, that will lead to acute kidney injury. Okay, but if we have a further or hypoperfusion for a lot of time, that will lead to hypoxia in the tubules of the kidney, and the hypoxia in the tubule of the kidney or the ischemia will lead to endothelial and epithelial damage. The tubular epithelium and endothelial cells need to have oxygen. Okay, but we have decrease in the volume, we have depletion in the volume, so we have ischemia. Okay, and that will lead to necrosis of the tubules, or what we call the acute tubular necrosis. Due to the acute tubular necrosis, we have obstruction of the tubules due to the deep press. Okay, so this is the glomerulus, and these are the tubules. Okay, so we have decrease in the blood flow to the glomerulus and the tubules, and that will lead to necrosis. Okay, necrosis. So the debris of these necrotic cells will accumulate in the kidney, and that will prevent or shut down the kidney, and that will lead to renal failure. Actually, this debris accumulation mainly happen in the proximal tubules. Okay, but still may happen in the distal tubules. So mostly in the proximal, still may happen in the distal. Okay, so this is one of the most important causes of acute tubular necrosis, but there are some other causes of acute tubular necrosis. We may have some cytotoxin that led to the tubular necrosis. The cytotoxins that attacks the tubular cells and lead to tubular necrosis, like myoglobinuria, hemoglobinuria. Okay, accumulation of the myoglobin, hemoglobin. That there are insult materials to the tubular cells, and that will lead to acute tubular necrosis and acute kidney injury as a result. Nephrotoxic drugs like aminoglycosides and other drugs, okay, will lead to that. Contrast media is an important, very important cause of acute kidney injury. So we have to give contrast media with precautions, especially in diabetic patients. Okay, we have to have good hydration, so on. Okay, so the contrast media may lead to tubular necrosis, an important cause of acute kidney injury. Insecticides like snakes, insects. Okay, snakes may lead to acute kidney injury. Okay, so again we have glomerular causes, we have tubular causes, and interstitial causes, and now we are talking about the renal cause of acute kidney injury. What may injure the glomerulus? The glomerulonephritis, like infection or autoimmune. What may lead to tubular damage? We have what we call the acute tubular necrosis, in which we have may be due to hypoperfusion and ischemia or cytotoxic materials that directly injure the tubular function or the tubular structure. Okay, we may have vasculitis, hemolytic uremic syndrome. Okay, in hemolytic uremic syndrome we have destructive RBCs that will lead to kidney injury. Okay, if we have interstitial, also we may have interstitial injury to the kidneys, like in pyelonephritis. Okay, so just I told you all these things to tell you how does the injury happen. Okay, so we have prerenal causes, we have renal causes, and we have the post-renal causes. Among these, the post-renal causes are of least importance. Okay, they are the most benign, the rarest causes of acute kidney injury. In post-renal causes, we have an obstruction to the passage of urine. Okay, in prerenal causes, it's about the blood stream to the kidney. In renal causes, it's about the interstitial or the tissue of the kidney itself. In post-renal causes, is about the obstruction of passage of urine due to tumor, due to stone, due to posterior urethral valve, very important in males. Okay, and how to suspect posterior urethral valve? We have urine, weak urinary stream. Okay, weak urinary stream. So posterior urethral valve, very important in males. Stone, a tumor, trauma, urethrocoel, a neuropathic bladder, catheter that are forgotten in the urethra of the patient. Okay, all these are important causes of the post-renal. Anything that may obstruct the stream of urine after the kidney, in the ureters, in the bladder, in the urethra, stone, tumor, trauma, PUV, neuropathic bladder, anything will lead to acute kidney injury eventually. Okay, so these are the underlying causes of the acute kidney injury. Now let's move to the pathophysiology of acute kidney injury. The end results of the things I told you about the prerenal, renal, and post-renal causes will be insult to renal tubular epithelium. Okay, or maybe renal vasoconstriction. Actually, it is a cycle, vicious cycle, that you cannot just point to a point that you can tell that this is the start of the cycle. No, you may have insult to renal tubular epithelium as a starting point, as in renal tubular acidosis, for example. And this insult to renal tubular epithelium will release some vasoactive compounds like angiotensin, prostaglandin, adenosine, endothelin, nitrous oxide. So angiotensin, prostaglandin, adenosine, endothelin, nitrous oxide, and these vasoactive compounds that were released from the kidney due to insult to renal tubular epithelium will lead to renal vasoconstriction. And the renal vasoconstriction, it will also lead to ischemia to tubules, and again will lead to insult to renal tubular epithelium, and we will have vicious cycle. The cycle may start with renal vasoconstriction due to any cause, okay, or may start with renal decrease blood flow due to prerenal kidney injury, and that will lead to insult to renal tubular epithelium, and that will lead to release some vasoactive compounds like angiotensin and so on. Okay, and this is a vicious cycle. Okay, the end result of this vicious cycle, we have a decrease in afferent and efferent blood flow that will lead to decrease in glomerular filtration rate, and that will lead to reduction in urine output. You remember, okay, in the definition I told you that reduction in the urine output or in urine volume, oliguria or anuria, is the most important marker of acute kidney injury. Now we understand why we have a decrease in glomerular filtration rate. Okay, reduction in urine output. That's why oliguria and anuria are the most important and immediate signs of acute kidney injury. The creatinine may be normal until about 50% change in glomerular filtration rate. After that, the creatinine will start to change. Okay, so these are this is what happens in acute kidney injury. Okay, so we have dealt that the most important two things is the urine output and the creatinine ratio. in the next video I'm going to talk about the Rifle criteria. I'm going to put the acute kidney injury in stages according to the urine output, or due to according to the stage of urine depletion or oliguria or anuria, okay, and according to decrease in increase in serum creatinine. Okay, according to these two things I'm going to put the acute kidney injury into staging. So see you in the next video. Thank you for watching that. I'm going to start with the Rifle criteria.